and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Bob and Brad, the two
That's
most...
enough,
Does that
Bob.
ever get caught in your head?
Yeah.
Okay, today, Brad, we're going to talk
jingle.
about the jingle. Yeah, top 10 worst jobs for back pain. This was put out by the North American Spine Society. And you may have one of these jobs. We'll see.
We're not saying they're the worst jobs. We're just saying they're
worst jobs for back pain.
they're high risk for injuring the back.
Yeah, and a lot of you who have these jobs might have back pain, and we're going to show you how to improve your situation if you do have one of these jobs.
Exactly.
So, and as an overall kind of concept here, basically, if you're doing something that hurts, we're going to have you do the opposite to take it away.
Right. Which sounds kind of like, what is he talking about? But think about it. If you're doing a lot of bending forward, your body needs to stretch the opposite direction. And you'll see this come out throughout their suggestions.
This is going to be our theme here today.
Exactly. Now, Bob, there are people out there who have not seen our videos.
We forgot to do this on the last video.
No kidding. But we do have a subscribe button here or here somewhere on the screen, and you're welcome, and we encourage you to hit that so you can get more.
We're going to provide videos on how to stay healthy, fit, and pain-free, and we upload every day.
Excellent.
Now I have to go back to that other video and figure out how to do this. So, all right. Number 10. We're going to start with number 10, and then we're going to go all the way down to number 1, which is the worst.
Sure.
So it's the big countdown, Brad.
Okay.
Number 10 is motherhood and baby care.
This is a job that is really taxing on the back,
Yes,
especially
it
with
is.
those infants when they're young and you got that crib, and you're almost forced to go over that crib. You are to pick your child up carefully, and you're not going to worry about your back. You're going to worry about your child, of course.
Ideally, it's nice to have those cribs where the side goes down.
Yep,
you know what I mean? Because then you can
exactly.
reach over. Because there's almost no good way to do it if you
got to reach over the crib.
I mean, the only thing you're trying to do is keep your back as straight as possible, as always with that. But one thing mothers tend to do is they tend to, I'm Lonnie, I'm up. They tend to kind of put the baby on the hip like this. You
Now,
know
this
that?
is a really bad model of a baby.
No, this is a good baby because these are baby. This is the Packers,
Green
and
Bay-
they tend to cry a lot. You know, when they don't
they're
get their
very
way.
strong. They're
So,
strong.
I'm sorry, I didn't mean to hit the baby. But you want to put the baby on your hip like this. All I'm suggesting, that's fine.
Right.
But I'm suggesting is every other time, put it on the other hip.
Sure.
So
Or if
you're
you're
gonna
holding
balance it out.
the child for a long period of time, every few minutes, switch sides.
Right,
And just
very
go back
good,
and forth.
yes.
There you go.
So the other thing that I know a lot of new mothers have trouble with is that they're picking their kids up a lot.
Sure.
So one, don't just do this where you keep the knees straight and bend over like this.
Right.
I don't care how light the baby is.
Right.
You want to bend your knees. A lot of times the staggered one
Sure,
is good for
yep.
this because you can go down like this, keep your back straight,
Right.
and you're going to go up.
Right here.
So.
And also getting down on that one knee, I think, is a really good
Right,
option.
exactly. Especially you're younger, you can get down.
Exactly. These people are 20, 30 years old. They
So-
can do all this.
Going into the car and putting the car seat into, the other thing is they open the door. I don't want you just to go in like this and
Right.
hook it. Get in like this, put the one knee in, and give yourself support. And it's easy to keep your back straight that way,
Yep.
too.
Get that knee, slide it right in on the seat. If you got toys on there, shoo them off, get them on the floor, they belong, and get your knee and support your back.
All right. If you have any other questions about motherhood, something that you're having trouble with, well, not that part. I'm just
Let's go on to the next
number
one.
9, factory work. This is one where what is really helpful with this, Brad, I think, is, and you've had experience with this, we've gone into factories and looked at
Sure.
them.
Like if you're working on a punch press or you're doing some repetitive motion at the waist-high level, oftentimes what can help if you're having back pain or leg pain is simply take the weight off. And if you can have a stool that's not too short, this would be a little too short.
Yeah, a
Possibly
pretty high stool.
Right.
That you're almost half sitting, half standing.
Right, and they call this a sit-to-stand workstation. And you just take the weight off, you sit down so that you got your feet on the floor and you're able to work and function just as well as standing, but you're reducing that stress on the back and the legs. And then you stand again. So every 5 or 10, 20 minutes, you'll go sit, partial sit, and then standing.
And then a lot of times, like having cushioning underneath you.
Oh,
is
right.
nice, right?
That's
Or
big.
Good cushioning in the shoes themselves too. Right?
Yeah, if you're hard concrete and they don't have the rubber mats, get the inserts that are in your shoes to help reduce that stress.
All right, how about an auto mechanic? That's number 8, Brad. You know, a lot of times they're bending and twisting. You know, you work on cars more than I ever have, but I know some of them, they put it up on the jack, and they're working this way.
Right.
But other ones, they're all, you know, bending into the vehicle.
Over the hood,
as much as you can. With that, you really, again, you can put your knee on a spot sometimes on the bumper.
Sure, possibly.
Possibly, or if you can support yourself with the other hand, that makes a big difference. You know.
Yeah, and I think that's some of these things that these mechanics, they probably
know
do
this
that,
already.
but they may not be stretching backwards on a regular basis to offset that forward flexion all the time. Straighten the back or stretch the back in the opposite direction after you've been working for 20 minutes and you're, you know, they're contortionists. They got to get their arms around all these things and cursing at the engineer who designed it, and then they come out and do that stretch.
Yeah, that's probably the biggest thing you can take away from today is anytime you're doing a lot of bending forward, if you could go ahead and reverse that and give it a stretch the other way.
Same with the head. If the head's really forward, we do the chin tuck and go the opposite direction to relax those muscles.
All right, how about number 7 as a warehouse worker?
Sure.
Brad? So I imagine a lot of lifting with them and maybe driving a forklift, I suppose?
Right. Yeah, I think if we're talking about stocking shelves warehouse versus the one where they have the pallets, the pallets with the
lifts?
The forklifts, excuse me. You know, some of the forklifts are the stand-up kind, and they got the wheels like this, and that's one thing. And if you're standing up all the time on that, you're going to want to actually sit down and possibly do some leaning forward and doing some stretching like this, as opposed to the person driving the forklift in the seated position. If you're in that forklift for 3 hours in the seated position, you're going to want to get up and actually go the opposite direction. So these things are variant depending on the position that you're mostly in. If you're a warehouse worker and you're doing a lot of overhead work, you're stocking shelves overhead, then you're going to want to stretch forward. That'll feel good. But if you're stocking a lot of shelves low down and doing a lot of bending, it's the opposite. You're going to want to stretch this direction.
Your back, when you're standing, you're kind of jamming the facets together a bit.
Sure.
You know, and especially if you're back like this at all. So like Brad said, that flexion is really going to help you. All right, number 6 is a dentist, Brad, and I've treated a couple dentists, believe it or not.
Sure.
And one of the problems I see with them all the time is they're in a position, like a similar position all the time. Like they tend to have a tendency, like if they're going down, working them out, they maybe have their neck, bent to the right.
Sure.
So with him, it was simple because he was getting pain down the arm. We found out by doing chin tucks and stretching the opposite direction really made a difference. And I found this for myself, Brad. When I'm working at a desk, I tend to have my head cocked this way. So I do stretches the opposite direction. So you do a chin tuck and then go the opposite direction. Chin tuck. So because you really want to have good posture while you're doing this.
He's trying to show you the profile.
Yeah. So chin tuck this way. Chin tuck this way.
Right.
Amazing. I mean, Brad, I'm just shocked at how much it helps my pain.
Sure. Right. And the dentist had the same thing. So
and it went away. Yep. Manual labor. Now these are guys that are doing real physical work, and again with them, more than anything, kneel when you can, and take stress off the back. Also, keeping the back in the right posture. Brad, we didn't show this on the first one, but let's show it now again. If you're doing a lift or you're doing anything, you want to keep your back in that straight position. Look at how there's 3 points of contact here. If I'm lifting wrong,
here and here.
If I'm lifting wrong, there's 1 point of contact. Even though my knees are bent, there's only 1 point of contact, and now I'm putting my back at stress.
And I know these people who do this kind of work are going to say, yeah, that's easy for you to do here, which it is, and I know it's very difficult to do on the job site. Particularly, I think about because all the road construction I've been driving, they're doing rebar all below the knee, and they're wiring in this rebar, and they're just stuck in this bent over position for a lot period of the day. I'm going to suggest to them, actually get down. Can you move once for a second, Bob? And just stretch the back out in this direction. You're going to do some press ups this way. Obviously, on the job site, you can't do that, but you can get up and, again, try to stretching backwards.
Well, I would say with the rebar, though, even when you're down like this, as much as possible, put your elbows on your knees.
Sure.
And this takes some stress off your back. It's amazing how much it does.
Right.
I mean, if you're just like this versus like this, it's a huge difference. So, all right, number 4, office workers. We just did a whole set of stretches for the office worker, Brad. I think I'm
yeah.
going to put a link here.
Yeah,
for
that's a good idea, Bob.
So we just did the video, so you should be able to watch that and enjoy it. Number 3 is nurses. Nurses, I see them a lot of times. They're leaning over the beds, helping patients. And like you said, Brad, when we talked about this earlier, you should go ahead and put a knee up on the bed,
Right.
And take some of the stress off while you're working with the patient.
Right. Even if you're not helping with the rolling or the mobility, you're just doing some light duty work. This versus this,
Right.
tremendous difference on the low back.
A lot of stress, yeah. And we're moving down to number 2, construction workers. With them, again, I think that's just like the manual laborers that we talked about.
Right. I mean,
earlier.
they fit hand in hand.
Yeah, so. And number 1, the worst one, Brad, which may be surprising to people, is a taxi driver. And this is not shocking to me at all, because one, you're in a seated position, which, that's been the new source of back pain is sitting. And so we want to make sure when you're sitting that you're going to get some type of lumbar support. So you're sitting like this, you're in that flex position. Again, what's the opposite of that, Brad? Is to put a little bit of an arch in there. So
We're going to have our homemade lumbar support, which we can
a
use.
rolled towel, and you can put it there just around by the waistline. Find a spot that fits good, and then if you want to, adjust this, you can actually make a smaller towel or a larger towel.
Right.
If you have the adjustment in your car, obviously you use that. A lot of cars do have this.
Right.
And then the thing is, with a lot of taxi cab drivers, then Brad, they sit and then they go from lifting luggage. So
Sure.
make sure you're lifting the luggage with the back straight, like we showed you, and then doing some of those back extensions.
Right.
So-
Especially when they got to lift luggage in and out of the trunk, which is really hard to
Right.
maintain good body mechanics. So,
All right. Well, if you have one of these jobs, please give your comment, and we can maybe make another video if we
Sure.
have a specific problem.
we might
So,
make a few more videos, Bob.
Yeah, we might. Thanks for watching.